Hello everyone. Today I would like to discuss about a chapter in the lesser writing of Dr. Boenninghausen, which will beautifully explain when we are taking a case how to look for the smaller minute details and how to look beyond the symptom which the patient is portraying. For example, there is a chapter in his lesser writing by the name Concerning Motion and Rest. I think it is one of the most beautiful chapters if we want to learn how to investigate or how to ask question beyond a journal statement. For example, he focuses on the symptom motion aggravation, rest amelioration, or rest aggravation motion amelioration. We have heard remedies like brainia or stocks in it. Today we will not talk about the remedies he has given. He has given a set of remedies also. But we will talk about how he explains we should approach this statement, that is motion aggravation or rest aggravation. He first explains if motion aggravation is the symptom the patient is portraying, then it can mean three different things. First one being on first motion aggravation. The second being on continued motion aggravation. The third being aggravation after the motion has been done in the rest phase. I walked for a while. I did not aggravated on the walk or on starting the walk, but I aggravated after the walk was finished. So these are the three separate points he said. First we have to look for, inquire for these 3 points, because these 3 points have different set of remedies in it. Then he says, then look for violent motion or exhausted feeling or exertion. If the motion is violent in character or the body is getting exerted a lot, then comes another set of remedies. Then he says look for overheated aggravation. The motion in itself is not aggravating, but the body which is getting overheated by that motion, then it is getting aggravated. So another set of remedies come there. Then he said look for the particular kind of motion. When the body has been raised, when the body has been stooping down or rising from the seat, what kind of particular motion is there? Then another set of remedies come there. Then he says look for aggravation of stretching, aggravation from bending, aggravation from turning, specific motion types. It has different set of remedies. Then he also talks about aggravation on walking in open air, aggravation of walking in closed room, aggravation of walking in moist air. Then different set of remedies come in that. And then he talks about rest. And in rest he specifically talks about there is a general statement that aggravation lying down. So he says in what position is the patient lying down creates a different set of remedies. He is curled up in his bed, he's lying on his stomach, he's lying on his back, he's lying on the painful side, he's lying on the painless side. Look for these different types of symptoms. So next time you do your case taking and you ask this symptom and the patient says yes, motion aggravation or rest aggravation, then inquire these particular set of points, and that will refine your totality, that will narrow it down to the specific. And he mentions aphorism 153 of Organon, which specifically talks about narrowing it down to the peculiar symptoms, to the characteristic symptoms. So next time you do your case taking, do remember these points of Dr. Boenninghausen and do read his lesser writing chapter concerning motion and rest. Thank you.